Here we present a case of a diagnostic spinal angiogram on a patient who had a suspicious for a spinal arteriovenous malformation. Once we obtain access, usually a 5 or 6 French, into the right femoral sheath, we navigate the diagnostic catheter, which is usually the Cobra catheter. Usually a spinal angiogram is also obtained on an AP. We like to maintain patients under conscious sedation if they can hold their breath. If not, we will consider general anesthesia. We then start injecting and fishing up for the lumbar and thoracic radicular arteries. It is important to cover down from the iliac arteries, the middle sacral branch, all the lumbar arteries, and the thoracic arteries when we're considering a vascular pathology in the spine. Having an arteriovenous malformation on a specific level doesn't mean that the blood supply will come directly from that level. At times, the abnormal vascular pathology could be different levels above or below the pathology in question. So once we engage with the Cobra catheter in every radicular artery, we do a very gentle injection. And one, because we don't want to dissect any artery, and second, the catheter, specifically the Cobra catheter, could be unstable, and by injecting forcefully, we could come out of the artery and lose our chances. We always try to identify the important artery of Adam Kewitz. As we all know, it comes from the lower thoracic levels in the majority of the time. We always have to make sure we don't get confused with the renal arteries or the suprarenal arteries, which is not uncommon to happen in a spinal angiogram. In this case, after we have completed the lumbar and thoracic branches, we did not see any abnormal fistula or abnormal vessels, and we determined that this spinal angiogram was negative. Thank you.